Hello, welcome to Disability Awareness and Sensitivity Training. I'm Cory Nourie, your trainer for the day. I am the Transition Social Work Coordinator at the Nemours A.I. DuPont Hospital for Children, and I'm excited to share my information with you this afternoon. This project has been made available to you thanks to funding by the Delaware Division of Public Health Bureau of Oral Health and Dental Services, with support from the U.S. Health Resources and Services Administration. It's a collaboration between the Delaware Bureau of Oral Health and Dental Services and the Center for Disability Studies at the University of Delaware. Today's disability sensitivity training is a foundational knowledge session on disability, which is designed to enhance your understanding of who people with disabilities are and how to effectively communicate with them in your dental practice. By effectively communicating with patients with disabilities, you will enhance your skills to be welcoming, accessible, and accommodating. In this session, we will engage you in activities and discussions about these three foundational steps towards becoming more welcoming, accessible, and accommodating for patients with disabilities. This session is introductory and not intended to turn you into an expert. Our aim is to equip you with some of the general ideas and information that you can use personally and professionally. As we go throughout the training today, I really hope that you will think about your own personal experiences with individuals with disabilities and reflect on them throughout the session. The first part of our session is intended to help you think about who are people with disabilities. We want you to think about knowing your audience. When you think about your own experiences with individuals with disabilities, those experiences are influenced from a variety of factors, both your professional experience, your personal experiences, family experiences, and also through the media. So now take a minute to think about, how does the media portray individuals with disabilities? Think about times that you've seen individuals with disabilities in movies, on television, in commercials. What kind of situations do you see those people in, and how do people respond to them? People with disabilities are portrayed historically as being tragic figures. Oftentimes you'll see individuals with disabilities as people feeling pity for them, or sorry for them, or, oh, isn't it tough that they have that life? The same is true that people also look at individuals with disabilities as being heroes or amazing figures. And so the reality is the media tends to sensationalize people with disabilities to make people think that that's how everyone with a disability actually is. And the reality is that people with disabilities are people just like you and me, and they want to be treated just like everyone else. In fully understanding who people with disabilities are, it's important to think about the different models that exist around disability and how we are influenced by those models. Historically, the definition of disability has been very focused on a negative or medical model, highlighting a deficiency or something that is wrong or broken about a person. The medical model portrays people with disabilities as the disability that needs to be cured and not something that's just a chronic condition that someone lives with. Instead of trying to be bogged down by defining disability in one particular way, it's better to think about disability as a variety and a continuum that may or may not impact a person depending on the environment, policies, and perceptions. In fact, disability legislation actually protects people who are perceived as having a disability, so as to not actually worry about the technical definition. So in order to help frame how we're supporting individuals with disabilities in our dental practices, we're going to speak generically about a few of the very broad categories of disability. So there are multiple definitions of disability. When you think about it yourself, how would you define disability? Some people think of it as a medical diagnosis. Some people think of disability as the actual word dis, meaning not, or un, meaning unable to. And some people look at a definition of disability as being an allocation for funding, that someone needs that label in order to access services. So there are actually three large pieces of legislation that help define disability. And so I'm going to tell you a little bit about them now to help inform your knowledge of disability definitions. The Americans with Disabilities Act, the ADA, which is different in the dental practice, right? But the ADA for the Americans with Disabilities Act defines disability as physical or mental impairment that substantially limits one or more major life activities. A person who has a history or record of such an impairment, or a person who is perceived by others as having such an impairment. Section 504 of the Rehabilitation Act of 1973 defines a person with a disability as any person who has a physical or mental impairment that substantially limits one or more major life activities, has a record of such impairment, or is regarded as having such an impairment. Major life activities include walking, seeing, hearing, speaking, breathing, learning, working, caring for oneself, and performing manual tasks. The International Classification of Functioning, Disability, and Health, ICF, defines it as disability as functioning in multiple life areas such as seeing, walking, taking a bath, working, going to school, accessing social services. Disability is seen as a result of an interaction between a person with a health condition and that person's contextual factors, which are environmental factors and personal factors. And disability covers a spectrum of various levels of functioning at body level, person level, and societal level. Thus, disability covers impairments in body functions and structures, limitations in activities, and restrictions in participation. So instead of worrying about which one definition are we going to use, or if you're in your dental practice and thinking, wait a minute, what would the ADA say in this situation? It's better to think about the person as an individual who needs all different types of supports and services, whether you know they have a formal diagnosis or not. For purposes of today's sessions and some of our activities, let's take a couple of minutes to talk about 3 broad categories of function. So as you can see, we have it broken down into 3 areas: cognitive, sensory, and physical disabilities. So when you think about your interactions and experiences with individuals with disabilities, how have you seen cognitive, sensory, and physical disabilities be presented? For someone with a cognitive disability, that's really about how they understand information and process information. So some of the common cognitive disabilities you may have experienced or heard about would include intellectual disability, learning disability, and autism. Sensory disabilities is about how somebody interacts with their environment from a sensory standpoint. So some of the sensory disabilities you may be aware of might include someone who is blind or low vision, someone who is deaf or hard of hearing. And then physical disabilities would be the way that somebody interacts with their environment from a physical standpoint. So some common physical disabilities you may be aware of might include multiple sclerosis, spina bifida, cerebral palsy. It's really important to think about and understand that a person with one diagnosis could actually have impact and functioning in all 3 of those areas. So for example, you may have somebody with autism who has a cognitive disability in the way they understand information, but also has issues around sensory function. So it's just important to realize that we're supporting the individual as who they are and how they present, and not necessarily worried about where their actual level of functioning disability occurs. So it's important to think about in planning for our patients with disabilities in your dental practice that you should really consider how the patient's disability affects their ability to receive oral health care. You might encounter a person with a cognitive disability who becomes, when you present them with a vibrating dental tool, overstimulated. We must remain aware that one person's experiences with his disabilities is unique to him. So individualized approaches and practices will ensure you're able to meet all of your patients' needs, whether they have limitations in one, all, or none of these areas. This variety of function within and across disability types is an important point to remember when we discuss later in the session about how to interact with people with disabilities. Although there will be some common themes and approaches, we often will have to individualize or customize an interaction due to the unique functional characteristics of a person and the particular environmental and social factors that influence their experience of disability. And this will vary across dental practices. There could be some physical settings that won't present any sensory challenges for someone, and then in a different office exam room, there could be sensory issues for that person. So it's really important to make sure we're focusing on the individual and supporting them how they present. So in closing this first part of our session and thinking about who people with disabilities are, my goal is for you to realize that disability is broadly and variously defined, that it is an interaction of personal, social, and environmental factors, and it does not wholly define a person. Next time you watch a movie or TV and you see an individual with a disability in the setting, try to think about, is this person being presented as a whole person with tons of characteristics, or are we really focused on their character as having whatever the disability or disabling condition is? Because it's really interesting to see how the media portrays people with disabilities. This next session is really going to be focused on thinking about language and how do you actually approach people with disabilities to be supportive. So now we're going to do a guided imagery session. And ideally, I would love if you would close your eyes and just visualize this person I'm describing to you. Let me introduce you to John. John has brown hair and the brownest eyes you've ever seen. He used to be a successful patent lawyer, but decided he wanted a career in public speaking and now travels around the country as a much sought-after speaker on civil rights. John hires a housekeeper to clean and cook for him because he's a terrible cook. He travels all over the world. So now take a minute and think about John. How did you visualize him? What did he look like? How is he dressed? When people sit next to him on an airplane, how do they respond to him? A lot of times in this scenario, people talk about John being tall, dark, and handsome, or a total bachelor. And, he's living a great lifestyle in a bachelor pad. He's got his housekeeper there, and he's just living a great life. Is that how you visualize John? What kind of clothes is he wearing? Was he in his business suit because he's presenting information to people on a regular basis? Or is he more approachable and more casual? Now close your eyes again. Let me introduce you to Stanley. He is crippled due to a birth defect. He is confined to a wheelchair. He has a nurse come in to help him get him out of bed, get him dressed, and to make his breakfast. Stanley has a service dog who helps him when his nurse is not there. He goes to work in a van designed for the handicapped. So now open your eyes. How did you visualize Stanley? How was he dressed? Was he wearing a business suit? Oftentimes people say, well, he uses a wheelchair, so he's probably in an easy to access clothing, something with like sweatpants or something with elastic waist. When people see Stanley around, how do they respond to him? Does he seem like he's approachable? Are people scared of him? Do they ignore him? Do they talk to his service dog because his dog is there? Oftentimes people in this situation talk about the fact that Stanley needs a lot of assistance and support. The problem in this scenario is that John and Stanley are the same person. The difference is the words I use to describe them. So the importance of language is the recognizing that language evolves over time. And so this is one of my favorite quotes actually from Mark Twain, where it's the difference between the almost right word and the right word is really a large matter. It's the difference between lightning bug and lightning. So you think about what a lightning bug is, right? This tiny little bug that flitters around in the summertime and flashes lights. And you think about lightning as a giant weather event, a very powerful storm and lightning. And you compare the two, and the difference of that word bug really makes all the difference. So it's important to realize that the old adage that sticks and stones may break my bones, but words will never hurt me, doesn't really hold its weight. In fact, language is such a powerful tool that perhaps it's the most powerful because it really influences how we think, talk, and act. So in order to achieve inclusion of people with disabilities, we must use people-first language. Now, this is a concept that I think especially for people who've been in healthcare and the dental world, it's kind of counter to how you've been trained because typically your training has been so focused on a diagnosis of something that's wrong with someone and what is the issue we're fixing, that people-first language is actually kind of a major brain shift for you. And so I'm not expecting you to become an expert in listening to this today for the first time, but the goal is that it starts to plant a seed so that way as you interact with individuals with disabilities over time, you start to catch yourself and think, wait a minute, what was that thing about people-first language, or how could I say that in a different way? So the general concept of people-first language is to literally put the person first. So instead of using any other characteristic about the individual, mainly their disability, the focus is to identify the person as a person first who also happens to have other characteristics about them. The goal is to avoid negative words that imply tragedy. So thinking about how the media portrays people with disabilities as, victims or somebody who's suffering with the condition. People-first language says this person has a disability, just like they have a job, just like they have a house or they have a spouse. The idea is the person, you're promoting understanding and respect and dignity for the individual with a positive outlook. And we're focusing on abilities and not limitations. So as an example, you would say David has autism rather than David is autistic. In our language, in American language, we would say that is often synonymous with equals. And when we say David is autistic, you think about David and autism as being equal to each other. And the reality is that David may have autism, but he also has other characteristics and traits about him. So people-first language is really taking a pause on labeling the person with a disability because of their disability and recognizing them for all of their strengths and weaknesses and characteristics together. There are also some other kind of rules of people-first language, so to speak. So we would say that somebody uses a wheelchair rather than is wheelchair-bound. Because if you think about what wheelchair-bound means, what does it actually mean for the person? Oftentimes it means the person is strapped in, stuck in a wheelchair, and cannot get out. And the reality is that a person uses a wheelchair the same way that I would use my legs. It's their way they get around and their mobility. So we would say a person uses a wheelchair rather than is wheelchair bound. People First language also wants to highlight people as individuals and not assume things about the way that their disability impacts them. So we try to avoid those kind of superhuman words like the unfortunate, the afflicted with, the victim, because we don't know how somebody actually interacts with the world based on their disability. And so if they tell you, that's one thing, but for you to otherwise look at somebody who perhaps uses a wheelchair or uses forearm crutches, if you see that person, you say, oh, they're suffering, you have no idea if they're suffering or not. That perhaps could be how they've been since day one, and so they're not suffering. Right? We'd rather not have you assume someone is suffering unless they tell you that. So in general, we want to say, who are people with disabilities, right? They're sons and daughters, they're mothers and fathers, they're employees and employers, they're scientists, friends, neighbors, they're everyone. They are all people first. And so it's important to think about people first language in how we interact with individuals, because I really think if you think about how do you want people to respond to you, or if it was your daughter, your son with a disability, do you want them to be only identified based on that diagnosis, or do you want them to see the whole person and all of their awesomeness? So now that you've suddenly become an expert in people first language, I'm going to give you a few sentences to see if you can figure out how you would change the language to be more respectful or more people first friendly. So if I gave you this sentence that said, handicap parking is to the left, what would that mean to you? So this is actually a trick question. So handicap is a word that we often use and say it's the same as disability, and they're actually two very different definitions. So handicap is actually a barrier in the physical environment that limits a person's ability to function. So if we say handicap parking is to the left, what does it actually mean? They actually mean the parking designed for people with disabilities that makes it accessible is to the left. And so accessible means it's the opposite of handicapped, actually, right? Because you think about those parking spots, an accessible spot has a curb cut out for somebody who uses a wheelchair. It's closer to the front of the building, so that way it's easier to get into. And it's specially marked, so that way only people who have that special tag or license plate are allowed to use it. So we would actually say, instead of handicap parking is to the left, we would say accessible parking is to the left. And I threw that one in just to mess with you because I know you actually didn't know that one yet. Other sentences, let's say they adopted 2 kids with Down syndrome. What would you do in that situation? Okay, so I said kids with Down syndrome. So instead of saying Down's kids, which is oftentimes a way that people refer to somebody with Down syndrome, we say kids with Down syndrome. And I don't know if you know this or not, but anytime there's a diagnosis that actually has an apostrophe S at the end of it, we actually nowadays don't use the apostrophe S as a possessive definition. So if you have somebody with Asperger's syndrome or Down syndrome, you drop the apostrophe S, so it just is Down syndrome, which makes it a little tricky because syndrome starts with S, so it gets confusing. But when in doubt, drop the apostrophe S in the diagnosis. Okay, so now we say they adopted 2 kids with Down syndrome. How can we make that sentence even better? A lot of times, people in our society like to label people and identify them for being different. And so in that situation, in that sentence, I would actually get rid of the adopted part completely. Because when you think about somebody being adopted, what does that mean for that family? It means that child is now part of that family. There's no question about who they quote unquote belong to. And so in that situation, I would say they have 2 kids with Down syndrome. I would also question, why are we even telling somebody they have Down syndrome, right? So if you're talking to somebody else who is trying to learn more information about Down syndrome, or they have a child diagnosed with Down syndrome, you might say, oh, Bob and Sarah, they have 2 kids with Down syndrome, to try to, make a relation. But when in doubt, I would just say they have 2 kids. And so I usually share the example that I was adopted and people don't know that about me. But when I tell people that, suddenly people start to look at my dad and my relationship as being different. Instead of him just being my dad and me being his daughter, he became my stepdad, or people would identify him differently. And I'm like, hold on a second. So I think a lot of times we're so used to identifying someone as being different and trying to highlight that about them, that the idea of adoption in general is that person becomes part of the family, and it's not important to highlight the difference unless it's absolutely necessary. Other sentences. How about if somebody talks about normal children versus disabled children? So when you hear disabled children, I would automatically change that to children with disabilities. And then the question is normal. What does normal actually mean? And usually, if I asked every single person on the street, define normal for me, I'm going to get a different definition from every single person, because normal isn't really, there's not actually a universal definition. And actually, if you go home and look at your dryer, there's actually a normal setting on your dryer. And so usually I just say normal is a setting in your dryer, otherwise it doesn't mean anything. So what we typically would say would how somebody is typically developing. So you might have a child with a disability versus a typical peer or somebody with typical development. So I would just try to be careful about the word normal because it can be misconstrued or misinterpreted oftentimes. Okay, so how did you do on those sentences? Do you feel like you're now suddenly capable of going over and taking over the world with people first language? So here are some other tips to help you in thinking about people first language and how to present information and interacting with people. So we'd say to use the word disability, not handicapped, and also try not to use things that are kind of cutesy language like handy capable and that sort of stuff. It tends to give the perception of kind of infantilizing people with disabilities. Use appropriate adjectives like accessible seats versus handicapped seats. And also try not to use those broad stereotypes about heroic or brave or inspiring. A lot of times we tend to, again, want to highlight the difference of somebody with a disability. And so we'll say, like, it's amazing that she gets up and she goes to work every day because she has cerebral palsy. Where, is it really amazing? Probably not. The reality is that she's going to work just like everybody else is going to work. But if somebody with a disability does something that is truly heroic, you can identify them based on that situation. So if you have somebody who uses a wheelchair and they were outside and they saw somebody get run over by a car and that person who uses a wheelchair was able to lift the car off of the child, would that be a heroic situation? Absolutely. So you could say that person's a hero. But the fact that he gets up every morning and goes to work or, goes and volunteers or whatever isn't probably super heroic in general. It's important to realize that there are some disability groups who do not want people first language used about them. And the way I usually frame this is that I will never correct a parent or a relative of somebody with a disability, because parents can call their kids whatever they want. So, for example, as a parent myself, if I said my child is a brat, I wouldn't want someone to say, well, hold on a second, Cory, your child has bratty tendencies. Right? The reality is that parents can say, my child is disabled or autistic or whatever. But as a professional, the way that I would rather have you approach this would be for you to use people first language about patients in general. So groups who do not want people first language used about them typically are the population of people who are deaf. And that's because culturally, people who are deaf say that they live in their own special culture, actually, compared to the general population. And so they look at deafness as being a source of pride and not something that needs to be respected in a different manner. So if someone says, I'm deaf, you can just say the person is deaf, and that's okay. When in doubt, just use the person's name. And think about, how would I want someone to identify me in a situation? A lot of times a good framework to think about this is, in the medical world, we would say a person has cancer. We don't say a person is cancerous. And yet from the disability world, it's very common to say the person is disabled. And so it's a little bit of a brain shift, but the goal would be that you would start to recognize that people have disabilities just like they have other characteristics. Like, I have brown eyes, I'm not brown-eyed. And so now that you've had this information about people first language, my goal is that as you go out and interact with people both professionally and personally, as you start to hear people say certain words, you might start to go, ooh, how would I say that differently? Or that really struck me a different way. And again, you're not expected to know how to suddenly change all your language overnight, but the goal is that this has planted a seed and you'll start to pay attention to it and recognizing how would you want people to recognize you and identify you or your family members if that was the case. So now you think about how you're actually greeting your patients in your dental practice, and what does it actually mean to be welcoming? I think if we asked people in general and said, would you rather feel welcome or unwelcome in a situation? I think people by and large are going to say, I'd rather feel welcome. So what does it actually mean to be welcoming? So the definition of welcoming is to greet the arrival of a person with pleasure or kindly courtesy. And so it's really important in this situation, especially when you're working with new patients with disabilities or any new patient in general, because you may not actually know if they have a disability yet. But it's important to think about, what can I do and how can my office present itself to be as welcoming as possible to all people, in knowing that people have a lot of anxiety around dental procedures and that sort of stuff in general. So the goal is to think about, what can you do to become more welcoming, and recognizing you only get one chance to make a first impression. And if you think about somebody who's already nervous about coming to a new setting with new people and new surroundings and new smells and all of those things, and they come into your dental office, they immediately are making a judgment about how's the rest of this appointment going to go. And so the more we can do to be welcoming and making someone feel comfortable, the better it's going to be for you as a dental provider, but also for that patient and their family and based on that experience. So here are some basic etiquette and welcoming rules. And I use the word rules very loosely here, but these are just some guidelines to think about in how you're addressing and working with people with disabilities. So the first part would be to ask before you help. So this is something that is sometimes really hard to do because a lot of times if you see somebody who looks like they're struggling, your natural inclination as a human being, hopefully, is to want to offer to help out and jump in. And for someone with a disability, it's important to realize that that may be their baseline. That is how they've always managed to function in the world based on their disability. So if you see somebody who is struggling with something or something that you feel like you could do quicker or better or easier for them, it's important to not just jump in and do it, but instead ask them if you could assist them if they would need help with something. And be prepared that if they say no, that's okay too. You shouldn't feel insulted or get upset about it, but just recognizing that you're saying to the individual, hey, I'm here to help you. If you need help, let me know. If not, I'm totally here to support you and I'll be ready to support you in whatever way I can. So in my own personal experience in watching somebody who seems that they were having a difficult time and to demonstrate how it's important to ask for help, there's a woman who I used to work with who I actually had gone to school with, so it was a peer of mine, who actually had a brain injury from a car accident. And as she was in her rehabilitation and recovery period, I was working with her and she went to a soda machine. And from a physical standpoint, she has issues with tremors in her hands and those sorts of things. And so we went to a soda machine together, and she has a dollar bill. And the goal was to put that dollar bill into the little slot in the soda machine so she could get her drink, which I could do probably relatively quickly and easily and move on with my day. In her situation, though, part of her recovery was to figure out, how am I going to function in the world if I don't have somebody next to me all the time? So for her, she had a dollar bill in her hand, and her hand was shaking tremendously. And instead of, I could have just grabbed the dollar bill technically from her and just put it in and been done. But instead I said to her, if you need help, let me know. Otherwise, I'm here to hang out with you until, you get your soda. And so it's a little bit of just being able to recognize that this is how this person survives in the world, and what they need to be able to function is potentially more support than someone actually just doing something for them. Another welcoming rule would be to speak directly to the person. And so this is, again, thinking about people first language and acknowledging the individual. A lot of times when someone has a disability, if they have a parent with them or a support person with them, a lot of times the common practice is to kind of ignore the individual with the disability and instead just talk directly to the caregiver. And so my goal for welcoming rules would be to say, stop doing that and talk directly to the individual, even if you're not sure how the individual understands or how they're going to respond. The goal is that you're recognizing them as their own individual patient. They're the person who's going to have the work done in their mouth or their mouth examined. And so you want to give them the power to say, I recognize you, I see you as an individual here, knowing that they might have other levels of support or communication goals. That actually also sets the groundwork for the idea of treating adults as an adult. And again, sometimes when someone has significant intellectual disabilities or profound physical disabilities, a lot of times people have kind of infantilized that individual over the years and talked to the person sometimes in a high-pitched voice or like a child. And the reality is that an adult is an adult, and the goal is that you're treating that person as an adult. You want to use the same tone and volume that you would with any other adult. The next one should probably be pretty basic, but just in case, the goal is to respect privacy. And the way that this sometimes is demonstrated for people with disabilities is that sometimes if you have a caregiver with you, again, the assumption is, I need you to communicate with that caregiver only, and you might be sharing information that actually isn't necessary about the individual. So just in general, respect the privacy of every individual patient you work with. Let the person set the pace. So each person who comes into your dental practice has their own set of prior experiences, right? Some of which may be traumatic. So you want to take the time to actually understand that person and how they have had prior experiences with dental services, and see if you know there is something that this person gets very overstimulated. with too many sounds and smells and new people, it's important to recognize that ahead of time and take their lead. So if the person is going to get overstimulated in that environment, maybe there's some other situation or a different office you can use where there aren't so many people coming and going, or there aren't overhead bells going off and that sort of stuff depending on what your office setting is. You want to be sensitive about physical contact and explain what you're doing first, and then be sensitive to startle reflexes, sounds, and equipment. And this is particularly interesting for people with physical disabilities. A lot of times, if someone uses a wheelchair or some kind of adapted device like a wheelchair, people will just come up and kind of push the person in their wheelchair for them. And I wouldn't come up behind you and push your back to move you forward anywhere. And so when someone has a physical disability, you also want to get their permission before you do something to them. If they're sitting in the exam chair and you're going to start doing a procedure, the goal is that that patient understands what's happening next. And so sometimes this takes a little time and practice to get used to, but to be able to say, okay, now I'm going to touch your left arm and our left shoulder and put the bib around your neck. Because sometimes if someone has disabilities, they have a really strong startle reflex, and even a little bit of movement can really make someone have a heightened reaction, actually. Treat personal devices as personal. So this would be, again, someone who uses a wheelchair or who's using a cane or crutches, that we don't want to just take that and move that device out of their way without their permission. Another way that I can explain this is a lot of times if somebody uses a wheelchair, they have a backpack or a purse on the back of their bag. And in there would be their wallet that has their state ID or their license and their insurance card and that kind of stuff. But for a lot of people who have physical disabilities, they can't physically reach to the back of their wheelchair and get their wallet out of their bag or purse. So in that situation, though, every single time I would encourage you, if you have to be the person, if you're at the front desk or something, to say to the individual, hey, John, is it okay if I go into your backpack and get your wallet out now? And that's respecting John as his own individual person who has his own personal belongings. Because the reality is, I wouldn't walk up to a stranger in any context and reach into their purse or their own bag without their permission. And so for people with disabilities, we want to treat their personal devices as personal and also, again, respect them as individuals to say, this is your belonging, you're your own individual person. And if John says, no, you can't go into my bag, you need to respect that. And so it's just something that a lot of times I think people think they're being helpful, but another way to respect them as an individual is to say, is it okay if I move your wheelchair out of the way now? Especially for someone who uses a wheelchair, it could be really scary to have somebody actually move that device away from the person, because that's how they get around and interact with the world. And so if I use a wheelchair and I don't have a way to get to my wheelchair, I'm stuck. And so again, respecting the individual to say, now that you're in the exam chair and we're going to do your cleaning, I'm going to take your wheelchair and put it around the corner so that way I have enough room to sit next to you and do my cleaning. And once we're done, I'll go get your wheelchair and bring it back to you. That's a way, again, of respecting the person and their personal devices. And then the other area would be to think about needs ahead of time. So again, if you know somebody has a history of, maybe being really nervous in the office setting, or knowing that they might need longer time to process information. If you know that ahead of time, you can really plan for that. And so if you have somebody in that situation, you may decide that they're going to have the very first appointment of the day or the very last appointment of the day. So that way you have enough time to support them and support them in engaging in preventive oral health care. Another thing you could do is if you know somebody is coming in and they have a lot of equipment, perhaps you're giving them the one exam room that has more space. So that way, if they have a wheelchair and a service dog and an oxygen tank, there's enough room in that room that you're not having to jump over other people to get the things in there. So all of those things are good questions and things to know ahead of time as a way to, again, feel welcoming and engaging when someone comes into your practice. So wrapping up this session about communication and people-first language and how to be welcoming, we want to really recognize to always use people-first language when possible, avoid the stereotypes and the focus on negative things if possible, and then to check our assumptions and remember our lens. You've had experiences that have obviously impacted the way that you think about people with disabilities. And a lot of times it's really easy to remember the negative experiences, right? So if you take disability out of this scenario completely, when you've had something go wrong, it's really easy to focus on that negative thing. And so sometimes that kind of gets into the habit, I think, of human nature of just saying, I'm just anticipating this is going to go awfully. So if you think about that ahead of time and check your assumption, the goal is that you can say, let's start with a fresh slate today. This is a new person. who knows how they're going to interact with me and what this will be like. And let's try to be positive and focus on positive things as we welcome this new person to our practice and hopefully have them have a great experience in receiving oral health care services. So this is a funny slide, right? In that you think of Glinda and Dorothy from The Wizard of Oz, and you've had the power all along. You just need to learn how to use it. These are all skills that you probably actually already have. It's just a matter of actually turning the light on to that and saying, look, I'm going to use these things. I'm going to put them all into practice right now. And from this point on, my goal is to be as welcoming and engaging to support individuals with disabilities receiving oral health services. So we're going to talk about some of the strategies of how to actually interact and communicate with people with individual disabilities. So here are some general rules about interacting with patients who have visual impairment or blindness. And so this is, again, just foundational things. This is not going to turn you into the expert, and there's some situations where this advice may completely backfire on you, and that's okay. But in general, some of the concepts and things I want you to think about is that you want to speak to the individual when you approach him or her. So for somebody who is blind, if they're using their sense of hearing to identify where someone is, if you're approaching them from the right side, you should say, "Hi, Sarah, I'm coming in on your right side, and I'm going to sit down next to you." State clearly who you are and speak in a normal tone of voice. So sometimes people, I think by human nature for some reason, sometimes when someone has visual impairment or blindness, we forget that they actually can hear us still. And so it's often a common experience that somebody who's visually impaired or blind, we speak really loudly to. You don't have to, actually. You can just use a regular tone of voice. Now, obviously, if the person says, "Oh, and I also have a hard time hearing," then you might need to raise your voice. But when in general, state clearly who you are and speak in a normal tone of voice. If that person has a service dog with them, that service dog is seen as being part of their technology, so to speak, that they use, okay? So a service dog is not a pet. That service dog is working and providing a service for the individual. And so the goal and the recommendation is to never touch or distract the service dog without first asking the owner. And don't be insulted if the person says, "No, you can't pet that dog." Because that dog is focused on that individual they're supporting, and they're trained and they're paying attention to all kinds of signs and signals that you may have no idea about. So that dog can't be distracted by somebody who's like, "Oh, what a cute puppy over there." They need to be focused in supporting their handler. Another thing to do would be to offer to read and write on required forms for the office. So again, thinking about planning ahead. If you have a new patient coming in who you know is blind or visually impaired, you could say ahead of time, "Okay, I'm going to make sure we have somebody at the front desk who can be a scribe for this person, who can read this out loud to them and then give them a block on where to write." And that's actually, a very low-tech way to support an individual with blindness is a lot of times when somebody has to sign a document, if you just say sign right here and someone can't see it, that's not going to be very effective. So you could actually even just give a little block of wood even that you would put on the signature line. And that way the person with the visual impairment can feel where that block of wood is and they know to sign above it. You could also support that person by putting their pen on the paper at the exact point where they need to have their signature done. So there's lots of really low-tech ways that you could support the individual who's blind in being a new patient in your practice. Don't worry about saying things like "see you later." That's okay. That's a natural reflex and it's colloquial language. And so sometimes people, especially you think about people first language and trying to be respectful, you may say to somebody, "see you later." And then you're like, "Oh man, that may have been insulting." It's totally okay. Relax, take a breath. It's okay. You're all right. And then also, if you are approaching the person and going to help them in taking a seat, it's important to ask the person how you can best guide them. So some people might want you to place your hand on the back of their arm. They might want to hold onto your arm. Ask the person, let them lead you and guide you on how to best support them in the office. Because again, this is a condition that they've lived with for whatever period of time, and they know what way best works with them. Don't just assume things. When in doubt, just ask. So for our patients in our practices who are deaf or hard of hearing, again, some of these general examples that we're going to talk about as strategies are to get their attention. You want to tap a person gently on the arm or shoulder to gain their attention. Look directly at the person and use a regular volume. Keep your hands away from your face and use body language. So this can be confusing for some people because if somebody's deaf, they may or may not read lips. And if you are a person who speaks very quickly, or is super full of gestures when you communicate, that can actually be distracting if the person's trying to read your lips. So try to keep your hands away from your face, but use body language that's appropriate for the conversation. That is kind of universal body language that everybody understands. Ask the person ahead of time what's the best way to communicate with them. So some people may actually speak American Sign Language, ASL, and if that's the case, then you may need to arrange for an interpreter to come into your office and help ahead of time or help communicate with the person when they're there with you. Don't just assume that somebody speaks ASL if they're deaf. There's lots of different ways that people communicate. Some people may say, I don't speak ASL, but I can communicate by writing information down and passing that back and forth. So again, in planning for the patient in your practice, it's important to just know ahead of time and say, what kind of accommodations can I offer you? What can I do to best support you as being a patient? And if the person does use an interpreter, you want to look directly at that patient the entire time, not at the interpreter. So this sometimes gets confusing because the person who's speaking is coming from the side, but the goal is for you to be engaged with that patient and that patient to realize that you are providing services to them. And the interpreter's on the side interpreting for you. But again, that patient is the person you should be focused on. So sometimes we also suggest that if somebody doesn't understand what you said, if they're hard of hearing, instead of just repeating yourself, the goal would be to rephrase things. Because sometimes if someone's reading lips or has a hard time hearing, there are certain sounds that just don't click with them. And so if somebody doesn't understand, it's important to just say, okay, pause for a second and think about how can I rephrase it in a different way to make sure the person does understand you. And ask, do you understand what I'm saying to you? Short sentences tend to be better and more concrete versus a long-winded, very descriptive sentence if possible. Another way that you could be supportive of deaf patients in your office would be communicating with them via telephone. So some of your patients may use video relay services to communicate, or they may, you could use a telemedicine option of having an interpreter, an ASL interpreter on a cell phone or on an iPad or something like that as well. So again, talking to your patients ahead of time to find out what's the best way to communicate with them and support them. So for your patients who have physical disabilities, if they use a wheelchair, the goal would be to put yourself at the eye level of the person who uses a wheelchair, or just take a few steps back so that way the person doesn't have to look up to you. So if you have somebody with a physical disability using a wheelchair, if you get too close to them, if they're looking eye level, they're looking probably at your waist or your hips or something like that. And so the goal is that you can get down into a chair and sit next to them and have eye contact, or that you're far enough away from them visually so that way they can see your eyes and not have to be arching their back or something like that. In a perfect world, the goal would be, again, not to touch their wheelchair or walker without their permission. And also don't lean on it. So it's not like you're hanging out at a restaurant or a bar and you're just like casually there. If somebody has that sort of device with them, it's not for you to touch actually or to interact with. Don't assume the person wants to be pushed, and you always ask and respect his or her answer first. And then again, if somebody needs assistance, ask them if they want the assistance. And if they say no, that's fine. If they say yes, that's great. I think usually people get kind of sensitive to this topic. Sometimes people might say, well, how dare they not want my assistance? Well, that's how the person manages to get around in the world when you're not with them all the time. So to them, they're not struggling. It's just who they are. The same way, though, if you see somebody coming behind you whose hands are full of things and there's a door that you could hold open, my hope would be that you would offer to hold the door open for anyone, whether they have a disability or not, right? So don't feel like you need to go out of your way to not support somebody if it's just the common courtesy thing to do. And then for your office itself, from a physical standpoint, you could also think about things like universal design options for new equipment. There are exam chairs and office supplies and things that you could actually get that would allow a person with a wheelchair to not actually have to transfer into your office chair. Sometimes the wheelchairs can recline fully. Sometimes the wheelchair can rise up or go down depending on the height of the hygienist or dentist with you. And so you could talk about, if you're planning some upgrades in your office, what are some of the universal design concepts that you could use and implement that would actually make it accessible for everybody, regardless of whether it's a mom with a stroller or, a person with a wheelchair. There's lots of different options out there that you could consider. One of the very simple things would be in your office, the front desk, to have an entry point where people who are not super tall could actually see over the counter. So whether you have a cutout in your counter or no counter at all, so people can interact and be eye to eye with each other, no matter if they use a wheelchair or not. So when you're communicating with patients who have cognitive or intellectual disabilities, a lot of times people get really nervous about how do I interact with these individuals and how do I be respectful, or what if someone doesn't understand me? And so one of the things would be to try to limit the amount of distractions in the environment and use simple language when speaking to somebody. Not dumbing information down. Don't talk down to the person like they're a child or an infant. Just use simple concepts and language to support the individual in understanding the information. If your office, the front desk area, has lots of chairs and there's a TV on and you have the radio on as well and people are answering phones, that may be very distracting for somebody with intellectual disability or sensory issues. And so you may say, you know what, for this person, instead of making them sit in that waiting area, we're going to schedule their appointment ahead of time so that way they just come right in, they check in, and they go right back to the exam room. And that's supporting them both to make the patient feel comfortable, but also to make that patient have a chance to actually get through the procedure, the exam, with as few distractions as possible. For people with intellectual disabilities, you want to be prepared to repeat what you say orally, in writing, or with pictures. And that's one of the really easy things to do, is to say, how does this person best understand? In my clinical practice, it's one of the questions we ask every single person is, what's the best way that you understand information? And if the answer is through pictures, then we write that down. So that way, any new provider who interacts with the person could say, oh, wait a minute, let me get some clip art or some pictures to demonstrate what this means. The same thing is true that if people are visual learners and they're going to have a dental procedure done, you could plan that in advance and have something on your phone pulled up to a YouTube channel that shows a video of somebody having that procedure done. If the person does better with things written down, asking them, do you need things in a certain size font? If you're trying to communicate relatively technical medical or dental information, you might say, okay, I need to find information about getting a cavity filled that has pictures to explain it, as opposed to just giving somebody a book and saying, here, go home, take this home and read this. Most people would appreciate having information presented in a format that is actually accessible to them, and you can ask that question. Recognize that sometimes people have to make decisions, and sometimes people need more information or more time to process those decisions. So provide that extra time for decision making. Wait for the individual to accept the existence, or if it seems that the person needs more time, perhaps you schedule something where you do a 2-step procedure where you would have the initial meeting, talk about what would happen, and then give them time to go home and process it. Whether, they videotaped the description on their phone so they can take it home and listen to it again, whether they're giving them materials to go home and read about or to watch videos about, but recognize that someone may need some extra time for decision making, and that's okay. And you can be relatively flexible, potentially, depending on how emergent the situation is, in supporting that individual and allowing them to process the information and make the best decision for them. Recognize that information may not be generalizable across all settings. So what worked for one person with an intellectual disability may not work for the next person with a disability. And so just plan in advance and be flexible and realize that everybody's individual. They all come with their own history and experiences. And the goal is that every single person who walks through your practice doors is going to be able to receive excellent oral health care, feel welcomed and engaged, and be interested in coming back to you. As word spreads in the community about how welcoming your practice is, other individuals with disabilities will say, oh, yes, I've heard about them, and they seem like they really did a great job with so-and-so, and that'll open more patients to receiving excellent oral health care. And then the final thing there would be to offer help completing forms and reading as necessary. So if you have somebody who has a difficult time processing written information, to have somebody at the office who's willing to sit next to the person and read them the forms or explain to them what the forms say, helping maybe with signature line and showing where to sign the document, that sort of stuff. So after today's presentation and talking about ways to be welcoming, accessible, and accommodating for people with disabilities, the next question is, where can I find more information? So here's a list of different disability resources for the state of Delaware that has a whole variety of different options out there. So each of these websites is designed for a different purpose, but they are all chock full of great information about ways to support people with disabilities, being more inclusive and accessible. Any of those organizations are great resources to consider. So as you leave today's session, I want you to take home some general information and general ideas, recognizing that people with disabilities are all around us. They're our friends, our neighbors, our colleagues, and family members. No one experience is universal, so we have to be flexible in our approach. And by being welcoming, accessible, and helping eliminate barriers, you're offering patients with disabilities access to dental care that is critical for their overall health and future. And so when in doubt, use people first language, be respectful, and ask people how you can assist them. So thank you for your time, This is my contact information. Feel free to reach out to me anytime, and I'm happy to talk about any of these questions or any ways to support you in becoming more inclusive for patients with disabilities in your office. Thanks so much.